Welcome to Valora Health Talks. Today we are discussing something that almost everyone fears: cholesterol. Many people believe cholesterol is dangerous. Some avoid foods completely. Others ignore it. But what is the real truth? To help us understand clearly, we are joined by Dr. Daniel Carter. Doctor, thank you for being here.
Thank you. It's a pleasure to be here.
Doctor, let's start simple. What exactly is cholesterol?
Cholesterol is a waxy, fat-like substance that is naturally produced by our liver. It is essential for the body. It helps build cells, produce important hormones, and support digestion. Without cholesterol, our body cannot function properly.
So cholesterol is not completely bad?
No, not at all. Cholesterol itself is not the enemy. The problem happens when cholesterol levels become unbalanced or too high over time.
We often hear about good cholesterol and bad cholesterol. Can you explain the difference?
Certainly. There are mainly three types people should understand: LDL, HDL, and triglycerides. LDL is often called bad cholesterol because high levels can build up in the walls of arteries. HDL is called good cholesterol because it helps remove excess cholesterol from the bloodstream. Triglycerides are another type of fat in the blood. High triglycerides combined with high LDL can increase heart disease risk.
So it's not just about total cholesterol?
Exactly. Total cholesterol alone does not give the full picture. The balance between LDL, HDL, and triglycerides is very important.
Why is high cholesterol considered dangerous?
When LDL cholesterol remains high for many years, it can slowly deposit inside the arteries. This can narrow the arteries and reduce blood flow. Over time, this increases the risk of heart attack and stroke.
Why do people call it a silent condition?
Because most people do not experience symptoms in the early stages. A person may feel completely normal while damage is slowly developing inside the arteries.
Many people think cholesterol is only a problem for older adults. Is that true?
No, that is a common misconception. We are seeing more young adults with high cholesterol today. Poor diet, processed foods, lack of physical activity, stress, obesity, and even genetics play a role.
So even someone in their 20s or 30s should be aware?
Yes. Awareness and early testing are very important, especially if there is a family history of heart disease.
If cholesterol is silent, how do people know when something is wrong?
High cholesterol itself does not usually cause symptoms. But when arteries become significantly blocked, warning signs may appear. These can include chest discomfort, shortness of breath, unusual fatigue, dizziness, or pain spreading to the arm or jaw.
If someone experiences these symptoms, what should they do?
They should seek medical attention immediately and consult a cardiologist. Early evaluation can be life-saving.
Let's talk about prevention. What are the most effective natural ways to control cholesterol?
The foundation is lifestyle. A balanced diet rich in vegetables, fruits, whole grains, and healthy fats is essential. Regular physical activity, at least 30 minutes most days of the week, can significantly improve cholesterol balance. Maintaining a healthy weight, reducing processed foods, managing stress, and getting adequate sleep are also important.
Doctor, many people watching this might be wondering, what can they actually start doing from today? Especially regarding exercise and food habits?
That's a very important question. The good news is that lifestyle changes can significantly improve cholesterol levels. Regular physical activity is one of the most powerful tools. Activities such as brisk walking, light jogging, cycling, or swimming for at least 30 minutes a day can help increase good cholesterol and reduce bad cholesterol. Strength training a few times a week is also beneficial, as it improves overall metabolism and heart health. When it comes to diet, Reducing processed foods, fried items, and excessive sugar is essential. Instead, focus on vegetables, fruits, whole grains, nuts, and healthy fats. Small, consistent changes make a big difference over time.
So it's not about extreme dieting or intense gym workouts?
Exactly. Consistency is more important than intensity. Simple daily habits, maintain long term, protect your heart better than short term extreme efforts.
How important is regular testing?
Very important. Adults should check cholesterol levels every few years, and more frequently if they have risk factors like diabetes, high blood pressure, obesity, or family history.
When should someone definitely consult a doctor about cholesterol?
If their blood test shows abnormal levels, if they have symptoms, or if they have strong family history of heart disease. Also, anyone over 30 should consider routine health screening.
And if needed, which specialist should they consult?
A cardiologist or a qualified healthcare professional trained in cardiovascular care.
Before we close, we want to remind our viewers that this discussion is for educational purposes only. It is not a substitute for personal medical advice. If you have symptoms or concerns, please consult a qualified healthcare professional. Doctor, thank you for explaining cholesterol in such a clear and simple way.
My pleasure. Awareness is the first step toward prevention.
Cholesterol is not the enemy. Ignorance is. Stay informed, stay active, and take control of your health. Thank you for watching Valora Health Talks. See you next time.